concussion is tricky, and we're still learning a lot about it. Kind of like female athletes, we're kind of scratching the surface on concussion management still. And you kind of have to know a little bit about the physiology of it to really understand why it's so tricky. And so it's a mild traumatic brain injury, which can result from direct or indirect trauma. But what happens is you get sort of shearing forces in the brain that damage neurons. And what that causes is a global issue of like chemical and metabolic imbalances. And the reason why that's important is because there's not a specific part of the brain that's damaged. And so when that presents clinically, it can present in a myriad of different ways. Traditionally we think of headaches and dizziness and things like that, but it can be as simple as an athlete just saying they just don't feel right. There are red flag symptoms for sure. So things like repetitive vomiting, worsening headache, seizures, and of course, loss of consciousness. So those things should prompt immediate activation of emergency action plan. But most of the time, concussions present a little bit more insidiously, so a little bit more vague, which is why they're so difficult to diagnose and can be difficult to identify on the field or in a game or practice. And so really it just requires a high index of suspicion. So medical personnel, but also coaches and parents knowing if an athlete, and athletes too, knowing if they just don't feel right and they know that they got hit or they fell in some kind of way, there's no harm in pulling an athlete to the side and just investigating further and doing a quick evaluation. Yeah, so you can test extraocular movements. Really, those kinds of evaluations are trying to rule out like intracranial pressure or unilateral or focused injuries to the brains, like brain bleeds and things like that. And then there are a lot of different sideline assessments that you can use. Oftentimes, they're sort of tailored down to be quick and kind of as a screening process, but oftentimes you test balance, you test, of course, cranial nerves and extraocular movements like you were saying, and then also things like generalized strength, balance, coordination, things like that.